Welcome. I hope your day has been beautiful. Today I'm going to show you some great lower back stretches. And what's unique about this is that you can do it in the chair. You don't have to get on the ground. They're simple, quick, and very, very effective. But what we're going to do is we're going to cover the whole entire unit of the sacroiliac joints, the pelvic area, as well as the lower lumbar region. There's many muscles in there, but we're going to address many of them through the stretches that we're going to do right here in the chair. And you're going to feel immediate changes. Now, many people have an imbalanced pelvis where one side appears to be sitting a little higher or lower than the other. But understand that the body is a compensatory machine, that when there is imbalance, where there's contracture of one side, the other side is always trying to compensate. So while we do these exercises and stretches, always make sure you do both sides. Even if you're having pain on one side of your lower back and you do the exercise and you say, wow, I feel better, always do the other side so you can keep that symmetry. Now, one of the most important things you should be aware of, particularly when you do any type of exercise or stretch, is good posture. So when you sit down, try to really focus like there's a string pulling your head upwards. If you just feel that string pulling your head upwards, automatically your body will sit up much straighter. That's very important. So the first thing we want to do before any type of exercise or stretch is kind of warm the body up. Put it into flexion and extension, flexion and extension. So I just want you to lean forward, tuck your shoulders and head down, and then I want you to look up and lean back. Good, you'll feel a nice stretch in the abdominal area. And do that a couple times. Lean forward, kind of like the cat-cow, okay? And go back. Feel nice stretching those abs. Now understand, when we spend a lot of time sitting, those abs contract. That's why we're always being pulled forward. One of the primary causes of lower back tightness or pain that you're having, or even lack of flexibility, are the tight hamstrings. The hamstrings attach to the ischial tuberosity, the bones that we sit on, and goes behind the thigh, behind the knee. So imagine that these muscles are pulling like this, and it's going to actually pull it down like this. It's going to rock that pelvic backwards. And so that's why you may lean forward to go pick up something and hurt your back, because you have tight hamstrings. So let's stretch them real easy in the chair now. So put one leg out in front of you and put your heel on the floor. And where my hand's at right now on the knee, I want my chest to go to my knee. It's never going to go there. Just hold it to the point to where you feel that burning behind the hamstrings. You'll know where it's at. You'll hold that there about 30 seconds. Don't bob. Just hold it there. Then you'll come up. You'll come down again. You'll hold each particular stretch about 30 seconds. You do 3 sets on both legs. All right? Now, the next thing you want to do is you can challenge it. If you have a lot of range of motion, you notice you can go all the way forward, or your motion's really good. You can take the toes or the foot and bring it towards your shin. So in other words, bring it up like this. Now, what bringing it up is going to put more tension in the muscle, and then go forward, it's going to be much more difficult. So that's optional. So make sure you do 3 sets of both legs, 30 seconds each. Now, many of us who suffer with back problems usually have more pain on one side than the other. And the quadratus lumborum, the real thick muscles on both sides of the spine, those are real strong. So real simple, when you are sitting up, you can just take one hand and grab under the chair, or grab something on the chair, and sit up tall and kind of pull your body downwards, kind of anchor yourself in here where your shoulders coming down. And take the other hand, and you're just going to reach up as high as you can to the other side over your head, and just reach over. You'll just hold that stretch, and you'll feel that same side where your arm is up. You're going to feel that stretching, that same side. Hold that there about 30 seconds. Anchor yourself on the other arm. Pull yourself down, kind of lowering that shoulder. And let's do the opposite. And just reach up with the other arm on the towards the opposite side. And just feel that stretch as you come over like this. And hold that about 30 seconds too. That's an excellent stretch for the quadratus lumborum. Now, one of the simplest but very effective stretch is just pulling your knee up to your chest. That really stretches those lower back and pelvic muscles. So just get comfortable in the chair, whatever is good for you, and bring the knee up. If you have knee problems, grab under the the thigh here and pull it up, but preferably if you can, get that knee and just pull it up. You can put the foot on the chair if it's easier for you and just hold it there. And you'll feel an amazing stretch in the groin area, in the hip area, and the lower back area. And while you have it on the chair, what I want you to do is pull it over towards the side. And you'll really feel a nice stretch on the outside of the hip. And those muscles are really hard to get to, but pull it over. And then for the other side, bring it up like this. You can hold that up a good 30 seconds. You could do a couple sets of each of them. Try to anchor your heel on the chair and just pull it over again. And you'll feel that nice stretch on the outside of the other hip. And again, you can do a few sets of those and challenge your own body. Now, one of my favorite stretches that's going to help the pelvis, going to help the lower back, it's going to help the sciatic nerve if you're having sciatica, tingling, burning, cramping into the leg. This is by all means the best stretch. And I'm going to show you a trick how you're going to maximize this. Real simple. The involved side, my left pelvic is hurting me, my left sciatica is hurting me. Remember, we're going to do both sides anyways. But I'm going to take the left leg, cross it over my right knee. Now you may be saying, oh, I can't get it over my knee. Well, do your best. Don't worry if you can't look perfect. If it's that hard, you can bring this other leg down, okay? Instead of keeping it here, bring it down a lower, and then do it this way. But you're gonna do the best you can. But as you get better, you'll be able to stretch it more and more. So right now, we're working my left buttocks. I have my left leg crossed out over my right knee. Here's the trick, sit up straight. From the hips, not from the back, from the hips, take your chest and bring it forward to the heel, to the foot. And you're gonna say, wow, do I feel that? Don't bob, don't push yourself, get to the point to where you just feel that nice tension, okay? You'll hold this stretch about 30 seconds. Now the next thing you can do, you can take the knee and gently push it down and you'll get more stretching in that region, okay? But don't worry so much on the knee. You can challenge it if you like. But my main intention, and your main intention, is to get as much forward motion of your body to get more stretch. So if you can only go to here, do your 30 seconds, come back up, and then you'll do it again. Do about 3 sets of those. And you'll do both sides. So you'll cross the other side. And you notice this one's harder for me. I cannot bend it as much, but it's okay. Take the chest, bring it to the ankle, to the foot, and look at my elbow here. I can slightly push it down as I go forward. By pushing it down, we're taking the tension out of the muscle. This is called the piriformis muscle, and that's where the sciatic nerve runs underneath. It runs right underneath that muscle. So those people who've been to many doctors, who've been through medications and been through all kinds of invasive procedures, this little technique can do miracles. And I'm sure when you leave your comments down there, you're going to see lots of people who really benefited from this technique. So remember, you can push that knee down a little bit and go forward. For those that can't go forward too much, if you maybe only be about here, that's okay. Just go from here. And as you do this daily, over time, you're going to go further and further and further and further. And you're going to say, wow, I am so happy I stuck with these exercises, because they will make huge differences when it comes down to you getting well. Now find something in your house that's about 3 to 7 inches in height, just as long as your foot can go on top of it. Because what we're going to do now is we're going to just put pressure on our feet to kind of challenge that imbalanced pelvis, to get both of those muscles to fire. This is going to help that imbalanced pelvis. Let me show you. Very simple. You notice that my foot here is about maybe 4 inches higher than the other foot. It could be anywhere between 3 and 7 inches. Hold on to the chair so you can brace yourself. Leaving the other foot on the ground, I want you to just take this foot and push down on the ground. Push downwards on that. Push down for 10 seconds, isometrically. 10 seconds, and then relax. Then you'll push down again, 10 seconds. Okay, you're just firing those muscles in the glutes, firing the muscles in the legs, upper thighs area, and the pelvic, and relax. And you'll do that 3 times, and you'll come on the other side, put this foot on the ground, and push down. Good. And just keep contracting it, and you're firing the other side of the muscles on the other half of the body, and you relax, and you'll push it again. Okay? So you'll do 10 seconds, 3 sets where you just push down, relax, push down again, relax. Do 3 sets of both sides for 10 seconds. And lastly, a great simple isometric exercise for our rhomboids. The rhomboids attach from the inside of the shoulder blades to the spine. And they are called our retractors. And those are the muscles that bring our shoulders back. So if you notice you're having forward rounded shoulders, which most of us do from texting and being on our computer, this is going to help your posture. Always good to end up with this exercise. And real simple, you're going to put your elbows at 90 degrees like this, like you're holding something in front of you, and sit up straight. And you're going to pull back and just squeeze your shoulder blades together. Hold it there for about 5 seconds. Oh, that feels so good. And go forward again. And bring it back. Just pinch those shoulder blades together. Oh, you're going to feel so good. And go forward. And just do that about 10 times, holding it around 4 to 5 seconds. And when you get up, you are going to feel like $1,000,000. So if you're having any type of lower back, pelvic, hip, or even sciatic pain, these simple stretch exercises in the chair are safe and very effective. And even if you're not having pain, doing these stretches will keep you flexible, limber, and prevent you from having any significant problems in the future. Please share this video with your friends and family. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.